Good morning, good morning, good morning. Yay, we made it. We made it. It's Friday, the end of the work week. And I know you're just looking forward to this precious time to relax with family and spend some more time with baby. This is Dr. Yonnette coming to you with another episode of Baby Talk. And I was wondering why I have been resisting this topic. But you don't have to wait any longer because here you have it. Today I'm sharing with you information on ADHD, attention deficit hyperactivity disorder. And I know a lot of you have been having experiences with this condition. So let's talk about it. What is ADHD, attention deficit hyperactivity disorder? This disorder is one of the most common disorders in childhood development, and often it lasts into adulthood. Some people with ADHD show mostly the inattentive symptoms like being disorganized or having difficulties finishing a task or even paying attention to details and following directions. And then you have other people who may show mostly the hyperactive, impulsive symptoms like fidgeting and talking too much, that motor mouth piece that we were talking about, and finding it hard to sit for a long time, interrupting others or speaking at inappropriate times. And then many people would have the combination of the inattention and the hyperactivity. But although ADHD cannot be cured, these symptoms can be successfully managed, and some symptoms may improve as the child grows older. So let's talk some more. This information is presented from the CDC, and I want you to take good note. Let's do a little quiz, pop quiz together. First question: deciding if your child has ADHD is a process, and it involves several steps. There is no single test to diagnose ADHD. Is that true or false? Yes, that's true. There's no single test, and many other problems like anxiety, depression, sleep problems, and certain types of learning disorders can have similar symptoms to ADHD. One step of the process involves having a medical examination, including the hearing and vision, to rule out these other problems and the symptoms that are similar to the symptoms you see in ADHD. And then you have another part of the process that includes a checklist for counting ADHD symptoms and taking a history of the child from the parents, the child's teachers, the child's caregivers, and any other individuals who may be involved in the child's development. Next question. Recent studies show that many children with ADHD have other diagnoses too. Is that true or false? Yes, you are so informed. Every child with ADHD should be screened for other disorders and problems, because according to a national 2016 survey that was done by parents, 6 in 10 children with ADHD have at least one other mental, emotional, or behavioral disorder. Identifying and treating the disorders along with ADHD is very, very important to helping your child achieve at their fullest potential. All right, you're doing good. 2 out of 2 so far. Next question. ADHD can be cured. True or false? Oh, that's totally, you're right. ADHD can't be cured. The answer is true. In most cases, ADHD is best treated using a combination of behavior therapy and medication. For preschool age children, and we're talking about children between the ages of 4 and 5 or 3 and 4, with ADHD, behavior therapy, particularly training for the parents, is recommended as the first line of treatment before you even try to introduce medication. What works best can depend on the child and the family. So good treatment plans will include close monitoring whether or not much of these plans help the child's behavior, as well as making changes as needed along the way. Question number 4. We have one more after this. Some children with ADHD have trouble paying attention, while others have trouble controlling impulsive behaviors, or are overly active, or have more than one kind of symptom happening at the same time. True or false? That's definitely true, right? Yeah. Children with ADHD sorry, can have a mixture of symptoms. We said that earlier. Or they can have mostly inattentive symptoms or mostly hyperactivity symptoms. Okay. ADHD is caused by eating too much sugar. True or false? You said false? That's absolutely correct. The research does not support the popular view that ADHD is caused by eating too much sugar. However, if you have poor nutrition, you can worsen the symptoms of ADHD, especially people that have an unhealthy lifestyle. Managing their ADHD will be more difficult. So that was cool, and you did awesome. 5 out of 5 correct. Here are some key facts to remember. ADHD is a condition, a common disorder in children. As a matter of fact, based on data presented in 2016, about 1 in 11 children had been diagnosed with ADHD, and I'm guessing the numbers are even higher now. Boys are 2 times more likely than girls to be diagnosed with ADHD. ADHD symptoms can change over time. Hyperactive, impulsive symptoms may decrease, but the inattentive symptoms may remain. ADHD symptoms like inattention and impulsivity can put children at risks in terms of their health, in terms of diseases, and in terms of injuries. And then in most cases, ADHD is best treated with behavioral therapy, specifically with parent training and with medication. But the most common treatment for ADHD is medication. About 2 in 3 children with ADHD are on medication. All right, let's keep going. We are doing fantastic. Prevention tips. Now, we said earlier that ADHD is not a preventable condition, but here are some tips that you can use to better manage the disorder. If you think your child may have ADHD, talk with your child's pediatrician or your healthcare providers. The diagnosis is made by a mental health professional like your psychiatrist or your psychologist, or by your primary care physician like the pediatrician that is working with your child. The next prevention tip is that after you receive the diagnosis, you and your child and the healthcare provider can discuss options of care. And then in most cases, the best treated your child is best treated with a combination, like I said earlier, of behavior therapy and medication. If your child is a preschooler, though, you want to make sure that behavior therapy and training for parents is what you are using. That's going to be your first line of treatment before you even try medication. Schools are a very important part of treatment. And I want to back up a little bit here and say I've always been encouraging you to journal. Journal about your child. So if you have that record of what you've been noticing in your child, then you are armed and you're able to identify the disorder in a better way. Public schools, though, can also help with diagnosis and finding out what kind of support your child needs. ADHD can put children's healthy development at risk. In addition to recommending treatments like behavior therapy and medication, make sure your child has a healthy lifestyle. He is eating well, he's having a well-nourished diet that is filled in the nutrients that he needs or she needs at this age to develop well. And then, there are lots of programs that are available through the CDC, through your schools, through community programs that you can get your child involved in so that he or she can get the best opportunity for success. Now, ADHD is a condition that affects many, many children. A large percentage of children, 6 in 11 children would have ADHD. And, it's not a doom and gloom situation. If you find out that your child has ADHD, just get the help you need and manage the condition so that your child is able to participate in school, participate in life, and feel good and encouraged about him or herself. This is Dr. Yonnette coming to you again today and sharing with you information on ADHD. I encourage you to take care of yourself, moms and dads. Give the world the best you. Be beautiful, be handsome, clean your skin, and then take care of your baby, helping him or her to see what standards you set for yourself, and then have those awesome standards set for your child. It's Friday. Enjoy the day, enjoy the weekend, and we will talk again on Saturday morning as we do Read Time with Baby.